Costa. What seems to be the problem today?
Well, I have a running race coming up and my knee's really been bothering me, so I just wanted to double check it before I really exerted myself.
Okay, well, it could be a number of things, including your ACL, MCL, your meniscus, or it could even be like your kneecap bone. So I'm going to have you get an x-ray because we have that in-house today and see if we can see if there's anything wrong, and if not, we'll run a few more tests, like maybe an MRI.
Okay, sounds good.
So the x-ray came back normal. We didn't see anything wrong. So I'm going to have you get an MRI. We're getting a new machine in-house next week, so you can just wait and use our machine. And for now, I'm going to prescribe a high-dose painkiller Vicodin and a steroid prednisone.
Okay, that sounds good.
Okay.
That seems really weird. I don't really know what those are. I think I'm going to get a second opinion. Hey, Emily.
Hey.
So, you know how my knee's been really bothering me? Well, I just got back from the doctor's, and they gave me these drugs, and since you're a nurse and all, I didn't know if you could tell me about them.
I think these are too strong for what you're looking for. This is a strong pain medication and steroid, and I think they're really expensive also. I think you should see a second opinion before you buy them.
Thanks.
Yep.
The problem is that patients can get confused when at the doctor's office. In an office, medical terms, and not layman's terms, are commonplace. Just like our ordinary patient in our scenario, it can be easy to trust a doctor. Asymmetric information is defined as a situation in which info is unequally distributed between the individuals in a transaction. The person with more information will have an unfair advantage in determining the terms of any agreement. This relates to our scenario because the doctor has more knowledge about knee injuries than the patient. Therefore, the doctor has an unfair advantage in determining any agreement. The agency problem is defined as a conflict arising when an agent, or in this case the doctor, is entrusted to look after the interests of others. The problem arises when the agent uses the authority or power given to them for their own benefit instead. This relates to our scenario because the doctor is telling the patient to wait to do an MRI in-house, which may not be in the best interests of the patient. This is also how the doctor influences supplier-induced demand by what they recommend for a patient to do. The doctor prescribed various expensive treatments to be performed in-house. The doctor prescribed expensive medications to be taken by the patient, and the doctor was acting in her own best interests. This is an example of asymmetric information between buyers and sellers. The patient was right to look for a second opinion.